Morning students. Today I am going to teach you the scapula. First I will tell you the side determination of scapula, and then I will tell you about its anatomical position. Now the scapula is the bone which forms the pectoral or shoulder girdle, and we have seen in the last video that along with the clavicle it forms the pectoral or shoulder girdle. This is the bone which is placed posterolaterally onto the thorax, okay? And this bone is triangular in shape. If you will classify this bone, scapula, it is a flat bone. See this? This is a flat triangular bone, right? Now this flat triangular bone, like any other triangle, will have the three borders and three angles. So let us see the borders first, and then I will tell you about its angle. Now three borders are the superior border. See here, this is the superior border, and you feel it with the finger. There is a border which is quite thin, and this is called as the medial border. Now this medial border is placed about 2 inches away from the median plane of the body. Say for example, this is the median plane, this is placed about 2 inches away. So this is the medial border, and another opposite border here extending from a fossa, what is called as glenoid cavity. There is a border which is extending right up to this lower angle, okay, or inferior angle. This is called as lateral border. Thus there are three borders. Again, if you are having a bone, you just trace your finger in your bone, or you just draw a simple triangular scapula and keep on tracing with your pen or pencil the borders, okay? So you will that way learn better and without losing your concentration, okay? So this is superior border, this is the medial border, and this is the lateral border, is always placed towards this, okay, pear-shaped glenoid cavity, which is articular in nature, and it will form the shoulder joint with the head of the humerus, right? Now we come to the angles of the scapula. Between this superior border here and between this medial border, this angle is called as superior angle of the scapula. On this side here, between the medial border, which is quite thin border, and then the lateral border which is extending downward from glenoid cavity, this angle here is called as the inferior angle. And the glenoid cavity itself, which is quite thick, forms the lateral angle. So there are three angles: superior angle, inferior angle, and lateral angle. If you see this scapula, it extends from second rib in relation to the thoracic cage. It extends from the second rib to that of the seventh. That means inferior angle is at the level of the seventh rib, right? Now let us see the surfaces. After knowing what are the borders and what are the angles, we should see the surfaces. For surface, just you hold the bone with your fingers and feel that one of the triangular surface is concave, okay? And this concave surface is called as the costal surface. This is called as costal. And why it is called as costal surface? Because it is in relation to the costal or the ribs, okay? The thoracic cage, that's why it is called, and that's why it is concave, because it has to accommodate the convexity of the costal, posterolateral costal curvature, okay? And here the other border is the dorsal surface, okay? Other surface here, not border, sorry. It is the other surface opposite to that of the costal surface. The opposite surface here is called as dorsal surface. And how it is identified? It is identified with the presence of this bony projection, and this bony structure which is attached onto the dorsal surface is called as the spinous process. In continuity with this spinous process, there is another self-like bony projection which is seen here. This is called as the acromion process. And the third bony process comes out from the upper end of this glenoid cavity, and it projects anterolaterally, okay, like a beak of the crow. That's why it is called as the coracoid process. So there is an acromion process, there is a coracoid process, and then there is a spinous process. So these are the three bony process of the scapula. Okay, scapula. Now, once you have known the borders, angles, surfaces, process, there will be no difficulty in identification the side of this bone. Now, for the side determination, you will have to feel this bone with your fingers. Keep the bone in such a way that this concave triangular costal surface should face anteriorly, just as I am holding. The costal surface is facing anteriorly, and thin medial border which extend between superior angle to the inferior angle should face towards the median plane, okay, because it is hardly 2 inches away from the median plane, okay. In that condition, what you will notice that the dorsal surface which shows the spinous process, okay, this is placed dorsally. It should be placed dorsally. Then this glenite cavity, which is an articular pear-shaped, smooth fossa but shallow, it should be directed towards the lateral side. And this direction of the glenite cavity will determine the side of the bone. So since this glenite cavity is directing laterally, costal surface concavity is facing forward, so this bone belongs to the left side, okay, it belongs to the left side. If I will show you the side determination of the other bone that belongs to the right side, you can see coracoid process, acromion process, spinous process, so dorsal surface, concavity here, okay, triangular area, and this is the costal surface. So this thin border is the medial border, so keep it medially. The glenite cavity is facing laterally, so this bone is of the right side, okay. So you will have to practice with the help of the right and the left bone to determine the side. Now then, we come to the another aspect of this video. It is that how to keep this bone in the anatomical position. For that, I will tell you that your upper border or superior border should face upward, the medial thin border should face median towards the median plane, and then the lateral border should place laterally, okay, laterally. Once you have achieved this position, then tilt your scapula in such a way that the costal surface, which is concave slightly, should face anteromedially. It should place anteromedially, and your glenite cavity, a shallow articular fossa, should face anterolaterally, okay, towards the lateral side. Anterolateral, not exactly lateral, in between anterior and lateral, okay, anterolaterally. So anteromedial and anterolateral, and then tilt the bone slightly, okay, so that the glenite fossa looks slightly upward. This is the anatomical position of the scapula. So you will have to study, okay, by holding the bone, okay, the bone, to determine its side as well as to determine its anatomical position. Thank you very much.